This is part 4 of the forensic exam, or the head-to-toe assessment. So once we have given report to the physician, then we're going to proceed with packaging, labeling, and sealing. And that is step 16 in the protocol. You're going to make sure to close all of the boxes and bags with evidence tape. It's important to consider any potential for contamination if an unsealed box or side. So you want to seal all sides. Make sure that you initial and date over the tape. So you're going to write, it's a really good idea to have a Sharpie, write over the tape and spill the initials and date over onto the box. So you're going to be writing where it overlaps on the tape and the box or parcel. That way it's very easy to show evidence of any tampering with the evidence that you've secured. Place a biohazard sticker on the outside, and then place a patient ID label on all parcels as well. As I mentioned before numerous times, it's important to photograph everything that you do. You want to show confirmation that this is how the evidence was in your possession and this is how it left you when you signed chain of custody. So you will actually prove the condition of the items by a photograph. You'll take multiple photos of each parcel. What I like to do is put all my parcels in one photograph. And here's an example. All the sides are sealed, and that's including the sexual assault kit, the DFSA kit, any external parcels like a clothing bag. You want to seal every single side. And if you notice, the tape wraps over and the initials overlap the tape, and then the date is along there as well. Here's another example. There's evidence tape here, and it overlaps, the initials overlap, and the date is here as well. It's got a patient label here, and this wraps all the way around the bag on the front and the back. And this is another example as well. It shows how it wraps, and if you notice, I want you to pay particular attention. There's initials on this side of the kit and this side of the kit. So remember, initials and dates, the dates are located along here. The initials and dates need to be on each area. That way there's no question if there's any tampering that's done, such as someone pulling the evidence tape off the box to look at the contents. It's very easy to see that the initials or the date don't match. They don't align anymore. I mentioned before when we were going over the sexual assault kit is this is what it'll look like when it's completed. So you're going to fill out the information. You'll put the patient ID label here. This is from a real case. So you'll put your name, and we'll blow this up a little bit more, and we're going to talk about it a lot in the live practice sessions. But there's a time that you secured your evidence. So when did you close your box? And that's this top section here. Then this middle section is who is releasing the evidence and who is receiving the evidence, as well as what items are all included in this evidence handoff. So this shows it's a kit by completion of this box, in addition to one clothing bag. And there's a very detailed description of what is in the clothing bag. And it shows where the exam was conducted, and it shows the city or county where it was conducted. And this specific kit, because it says Montgomery County Jail, this is a perpetrator exam that we completed. It was completed at a hospital, then it would say the name of the hospital and the city. As I mentioned before, there are multiple different documents that are also inside the exam. I mentioned that we have our own sexual assault exam documents that we provide you, but they're also at the bottom of the kit. You'll find resource pamphlets, And that's a great tool that you can simply give your patient. And we can also provide that when we provide our DC paperwork, our discharge paperwork for our St. of Butler County forensic exam. We can give them the summary of care from within, the resource pamphlets from inside the kit. Now I want to go over the follow-up recommendations, and this is what is expected on the follow-up. Patient education is a very important component of follow-up recommendations. Your job is not over once you seal that kit. Your job continues when you're providing DC paperwork, because that patient needs to have the appropriate referrals in place. It's not sufficient enough to provide medical care and the forensic exam and then maybe medications at the facility. They need continued care, as we talked about with our physician handoff. They may need multiple different vaccines. They may need multiple different testings. They may need to be rechecked for pregnancy in 7 to 10 days. Injuries that were sustained during the assault may need to be reassessed. So this is our DC paperwork that shows a very clear and concise summary of care. And this is the patient ID sticker area. And then you're going to provide the law enforcement agency that you provided the kit to, who was receiving the chain of custody. The top section shows items that were performed at the hospital, and that's this area here. So what was provided? Antibiotic administration? Did they do a serum or urine pregnancy? Was it negative or positive? And you don't have to stay for that. You can just simply put see hospital results for that, because they may run that after you leave. You don't want to wait around at the hospital for that. But if the hospital did decide to do hepatitis B or hepatitis C testing, or start their Hep B vaccine series, or if they ran their HIV baseline testing, did they give a Tdap at the hospital, or a HPV vaccine, which is very, very unlikely. But it gives a summary of care that happened at the emergency department. And then at the bottom, so it says recommended follow-up action or action items needed. This is where you're going to instruct your patient. It needs to correspond up here. If the patient receives, let's say for example, hepatitis, if they received hepatitis C baseline testing at the hospital, their journey is not over with hepatitis C testing. The hepatitis C testing needs to be continued. In addition to, if they get their hepatitis B, HBIG, which is the immune globulin, if they're tested for that or provided that, then they also need to continue the series. So you would mark a hepatitis B series vaccine, or if they receive nothing, they need to get that hepatitis B series vaccine started or initiated or discussed in an outpatient setting. So you want to make sure any items that you want the patient to follow up on, it needs to be checked. And I can tell you that one of the things that is the biggest audit fail for all examiners is the lack of attention they pay to the recommended resources for follow-up care. The patient has no idea what to do. They've just been assaulted, or reported assault. They have a million things going through their mind. It's important to get their attention and have them focus on what to do to avoid not only this potentially catastrophic thing happening to their life, but then becoming pregnant or having a positive seroconversion to HIV or hepatitis B, or a positive pregnancy screening, or an infection, an STD infection that goes untreated and develops into pelvic inflammatory disease. It's important to address these specific action items needed for follow-up. If they're negative at the hospital for their pregnancy, they still need to get another screening. It's recommended to get another screening. So use each individual area to ascertain what the patient needs for follow-up care. Does the patient need to have the HPV vaccine series? And we have it summarized here. If the patient's 26 or younger, they can receive 3 doses post-sexual assault for HPV exposure, and it shows when their shots should occur. So shot 1, shot 2, and shot 3, as well as the HIV retesting. It shows what the recommended timelines are based on the CDC guidelines. So it's very important that you give specific information to the patient about this. And you cannot perform the DC paperwork review until you have spoke with the physician to get a very detailed report. And that's why the DC paperwork is step 17. It comes after the MD and RN report, because you need to know, is the physician going to provide the patient emergency contraception in the emergency room? Are they going to give the antibiotics in the emergency room? Or are they going to do the hepatitis B vaccine initiation, or the hepatitis or the HIV baseline testing, or begin Truvada right in the emergency room? You need to have a continuum of care provided for that patient. This is page 2 of the DC paperwork. It's just a list of summary items for the patient, crisis hotlines, and you will have the patient sign, and you will sign stating that all of the patient on page 1 and page 2 have been reviewed with that patient. We also put in our discharge packets the Planned Parenthood and list of low and free or low income clinics in the Southwest Ohio area. So this will be included in the DC paperwork. Additionally, we will also have a 1-page Ohio Rape Crisis Center and Abuse Shelter form. And I will say that this has been used many times by the examiners. I will recall there was a recent patient exam that was conducted at a local hospital, and it was found that the patient was a victim of human trafficking, and a member of their trafficking team was present at the hospital. Obviously, we could not discharge that patient home, so we arranged that that patient was discharged and safely transported to a emergency shelter. So you may use this resource page yourself and not just have the patient call. You may need to get actively involved using these numbers to try to find an open vacancy. You don't want to discharge the patient to an unsafe area. So let's go back to chain of custody. You want to make sure that, again, it shows no tampering between 2 parties. It's also a paper trail for legal purposes. I mentioned before, you never walk away from a kit once you have opened it. It is your responsibility until you sign it over to someone else. You have to account for that kit for every second. So make sure you have all your supplies. Make sure that you've used the bathroom, because once you open that kit, it's yours until somebody else gets it. You have to take it with you everywhere. Say, for example, you leave something out of the room and you need to go retrieve that in order to do the exam. You're going to have to pack your kit up and take it with you. The dates and times must match exactly. There can be no lapse of time of any kind, even by a minute. There can be no lapse of time between the handoff and the receipt, agency to agency. We're going to give an example in just a moment. The parcel count also must be clearly labeled and counted at each handoff. So when you, the examiner, are handing off evidence such as 1 sexual assault kit, 2 clothing bags, 1 DFSA kit, then the person that's receiving that will make sure there is 1 sexual assault kit, 2 clothing bags, and 1 DFSA kit. I can't stress this enough that without proper chain of custody in place, any evidence that you collect is inadmissible in court. You must triple check your chain of custody for accuracy, because all of that hard work that you provided for that patient and all of the hope that you instilled in a patient to help the healing process begin was just dismantled, because anything and everything that you collected is inadmissible. So you have to make sure the chain of custody is accurate and in place, and copies are everywhere to all parties. This is an example of a blank chain of custody. So I want to go through it. This is already filled out for you. Sexual assault evidence kit. That's already filled out for you. You do not have to write that in. Then you can do clothing bags. So an example would be if you have a clothing bag of an external item, such as a shirt, you can put white female t-shirt size large, and you can, so be descriptive. Additionally, items released by and received by. It's important to make sure that a proper handoff is done. This is a full chain of custody form. So this is actually what is inside your forensic exam, big long PDF that you'll create. And this is what the form looks like. So again, anything here, you'll have a sexual assault evidence kit. And notice up here, do not count any clothing placed inside the kit. I want to explain why. Law enforcement, when they receive your kit, they cannot open it. It is actually against the protocol for the state for law enforcement to open the kit. Their job is to collect the kit from you sealed, intact, in an immediate transport, or within 30 days. Remember, with our Senate Bill 316 and Senate Bill 77, within 30 days, it has to be delivered to the crime lab. No one opens that kit except the crime lab. So what you are sealing at the time of the exam and you're packaging up, the next person to open that is going to be the crime lab. Law enforcement has no way to verify that underwear is inside the kit. Remember the clothing bags that we discussed. Anything touching the patient's genitalia could be or should be included inside the kit. If you name underwear as a clothing bag, there is no way that they can confirm that that underwear is inside the kit. So if you review back to the collection of the clothing in the previous sections, then it actually states, on the envelope it states it as a reminder, as well as reviewed in the presentation, you do not count parcels that are tucked inside the kit as a clothing bag. It's external items. If a DFSA is here, you would say type collected, was it blood, urine, or both? And also clothing bag, what type of clothing? So that's where you would put the white large female shirt. Now they're not going to be able to open it and confirm it's a white large female shirt. That's you as the examiner being extremely thorough. Now sealed by as well. So what time did you seal the kit? What time did that evidence get secured and locked down? That's what you'll put that in. And also, this is where it's items released by and items released by as well, received by. So agency receiving the kit and agency releasing the kit. So we already have it filled out, seen at Butler County Forensic Examiner. And it's items released to, so released by and released to. So you would sign here, you would sign, print your name and date, and then law enforcement, who is receiving that kit, they're going to sign who they're with, their agency, print their name and date and time. Notice here, times must match. Make sure that your chain of custody times and dates match exactly. And this is an example of a completed chain of custody. So the examiner even chose to choose a detective packet, and that's something that that we prepare and we'll go over in just a few minutes. as well as the gray bra, a red short sleeve shirt, and the sexual assault evidence kit. They have the patient's sticker, they have the nurse's name, where they collected it at, the date and time, and then items released by, and then items released to. And if you notice, I want to pay particular attention to the time, is 23:07. This says 11:07. That is 100% acceptable because we use as nurses military time. If an officer writes 11:07 p.m., that's fine as long as the p.m. is there. The important thing is the date and the times match. So also review, there's 1 parcel, 2 parcels, 3 parcel, and 4 parcels. There's 4 items given to the UC police officer on this kit handoff. Another view, we showed this image earlier as a reminder, making sure that you're writing over the initials, over onto the evidence tape and onto the parcel. Let's talk about detective notes and crime lab notes. So this is a form that will go to detectives. Remember, we had discussed this earlier. Any really important information that you want to point out to the detective, they're going to get a 15 to 25 page document, but there's a summary page that they know to go to for really critical information. And I also discussed that they are not allowed to open the kits. So if law enforcement want to know if the patient declined a portion of the exam, or if they if you were not able to perform any section of the exam, this is where you're going to relay that communication. And so you're going to let them know they are not going to find oral swabs. Let's say, for example, if the patient declined. So you would put an X by oral swabs and then next to it, why it was not collected. So patient declined, or unable to collect, patient has an ET tube in place, something like that. And then you'll do your exam articles. So how many clothing bags? Did you have a DFSA? And a very easy summary for law enforcement to know, does that patient want to talk to you or do they not? And then there's an area to provide any pertinent information, such as, remember we talked about during the questionnaire and narrative, was there a condom on the bedside table? Was it any type of known perpetrator and they're at a specific location, or the patient is texting a perpetrator during the exam and you want to let the detective know that you witnessed that behavior, and they may want to grab the patient's phone or subpoena the phone in for those records. It's really a conversation between you and the detective or you and the crime lab. Let's talk about paperwork distribution. So once you're done and everything is completed, what do you do with documents? As you know, most everyone is on electronic charting. So you're going to be creating, since you're on paper, you're going to be creating a hybrid chart. It's going to be a paper. So all copies of all documents go to law enforcement, and you're going to place those in a manila envelope. And so if you go back to the sample of the chain of custody, the detective packet, that's what that is. We all call it internally a detective packet, and that's what they know it as well. So all the paperwork is going in a manila envelope, and you'll seal that and place the patient sticker. And you can include that in the chain of custody. That way you verify, I gave this paperwork to this individual. Now it's on the onus of that individual to make sure that it continues down the chain. Additionally, all documents go to SANE administration, and you'll Forcura that. And we've had a brief introduction to Forcura, and so we're going to go over that a lot more in depth. There will be a video presentation on it. And the hospital gets everything. So one important thing to note is that you need to log the name of the receiving personnel. Because facilities are on a hybrid chart, it can be very easy for them to misplace that. And you don't want the onus of misplaced paperwork on you. You want to log who you are giving that chart to, the name of the individual. Don't simply write Huck or secretary. Write that person's name that has taken responsibility of placing that medical record that you just created with that forensic exam documentation. You want to write their name of who took it from you. So again, the three people that you'll be giving all copies of everything to: law enforcement, the SANE administration via Forcura, and the hospital. And you may feel free to place law enforcement and the hospitals in a manila envelope. We will provide those for you, and that will be part of your forensic supply that you can pick up at the office anytime, is manila envelopes. Please feel free to place the hospital's copy as well as law enforcement in separate envelopes. The only thing that differs is what documents go inside the kit. Now, I want to explain what happens when your kit gets to the crime lab. When your kit gets to the crime lab, a forensic scientist opens it up. And remember, they should be the first people opening it up since you collected it. They're going to take out your documentation. They are not going to look at your swabs yet or your envelopes. They're going to look at your documentation. They're going straight to your forensic questionnaire and your forensic narrative. And you are going to have a forensic scientist auditing what's called, and the process is called a first pass. So they're going to be auditing your work. They, at this time, are not aware of any samples that you have collected, such as the 6 examiner choice of your dry swabs. They know the standards, such as the oral swabs and the DNA reference standard and the fingernail swabs, but they don't know any specific other additional swabs you've done. What they're going to do is read through your questionnaire and your forensic narrative, and they're writing down where you should have collected it. They're using your documentation from your questionnaire and from your narrative. They're looking for writing down where you should have collected touch DNA from, where you should see frank or gross DNA or possible sperm or possible injuries or documentation. That's what they're interested in. So then, after they have their list of where you should have collected, they go through your kit and see, did you collect it? If you did not collect it based on what your documentation was, then that's a bad audit. So they score that based on points. So I want to say how this relates to what paperwork you include in the kit. The reason that you include these documents is because these are the documents needed by the crime lab in order for them to do their job. So what items you put in the kit include the following: the questionnaire page, the forensic narrative, both pages of the diagrams, and the diagrams also include your findings pages. So remember, if it was a diagram that showed an injury to the left bicep, that was a dry stain. You also need to include the dry stain sheet. Remember, that shows the different sheets for the assessment. So the pain or the debris or the swabs or the findings or the other. So the diagrams and findings, they both go together. Where you give one, you'll give both. An example is that is here. The diagrams along with the explanation of what the diagrams mean go inside the kit. And additionally, the crime lab and detective notes. That's a simultaneous piece. And remember, these are copies, so everyone sees it. And the last thing that you'll include inside the kit is the consent form. That shows that that patient has approved you to collect that kit. I would recommend writing these items down. Some of the examiners actually print off their chart and they write specifically crime lab on these specific documents. That way they know it's a visual cue for them. These are the only documents that go inside the kit. Everywhere else, all documents go to everybody. Law enforcement gets everything, sane administration gets everything, hospital gets everything. The crime lab doesn't care about discharge paperwork. They don't care about their Plan B or their hepatitis status or anything else. They want what they need in order to process that kit. So we've covered a lot of information, and I want to go over a summary of several key points. So always change your gloves between each step to avoid cross-contamination of evidence. Every step you need to make sure. Always use an alternative light source. It'll aid in detection of DNA material or semen or vaginal fluid. Also remember, as we talked about in that early ALS lecture, not everything will luminesce. It may contrast. So use that alternative light source as an aid to see any type of injuries that may be present or capillary bed disruption or any contrast that's on the clothing that may appear from blood. And you want to use the assault and abuse questionnaire and the forensic narrative as a guide for your assessment. You're collecting the narrative and the questionnaire to help you determine on how to do it. Remember, you're matching and marrying information to see what the correlation and relevance is. Assess for injuries prior to collection of swabs. And this is going to be more relevant with the genitalia with the upcoming lectures. Also, all injuries found must be documented on the assault and abuse diagrams. And remember, where there is an assault and abuse diagram documentation, there should also be a detailed explanation of what that is. No one is going to know what F2 is or LF2. You need to have that corresponding chart, or that corresponding form for pain or debris or findings with that. And we're going to go into more in detail. Anterior assaults are more likely to have posterior injuries, and this relates to the genitalia specifically, or the anal. And a posterior assault is more likely to have anterior injuries. And again, we're going to go over that in the next lecture. All documented injuries must have a corresponding photograph as well. And not necessarily injuries, but if you find it pertinent, then you can take a photo of it. It is not necessary to document, photograph any areas where you do a dry stain unless you find it pertinent. And in order for you to do a collection of a dry stain, you need to tell the crime lab why you did it. So help substantiate your reason for choice for collection in that area. Chain of custody must be maintained at all times. During and after the exam, until you turn that over to another agency, it's your responsibility. You want to collect blood and urine samples for any scenario where the patient's judgment may or may not be effective, whether it could be voluntary or involuntary ingestion. Make sure your times match exactly on the chain of custody, and make sure that there's no lapse in the time that occurred from handoff to handoff. And remember, going back to an early lecture, a minor is able to consent or decline to a forensic exam without notification for consent to treat from parents. This exception would be a warrant for the exam. And also, do not ever use flash photography for injuries. It'll discolor injuries. And you also want to make sure that things are parallel as well. You never want to take things at an angle. Initial and date over the tape on all sides of the box, not just one side, but on both. Photos must be clear with no distortion. And make sure that you're doing appropriate MD and RN report to both. You're an extension of the physician, so it must go to both. And the person that you need to give the first report to is the MD. You will work with RNs. You'll work closely with RNs. However, when you're in the scope of practice as a forensic examiner, the primary person that you'll be interacting with is going to be the physician. Remember to give the resource information from follow-up care and the crisis lines. That's provided in your packet with your multi-page PDF that's on the Employee Gateway. But remember, there's also a few resources that are at the bottom of the sexual assault kit that comes inside the kit already. Those are great resources for the patient. So all copies go to hospital, they go to the law enforcement, and they go to SANE administration. SANE administration, we get our kits via Forcura. In the law enforcement, they'll get everything as well. In the hospital, maybe tuck both away in a nice tidy manila envelope, close it, and place the patient's sticker on the outside. And the kit, what goes inside the kit, which is going to go to the crime lab for processing, would be the questionnaire, the forensic narrative, the diagrams along with their corresponding information about the explanation of what they are, the crime lab and detective notes, and the consent to perform the exam. I want to close with this referral back. So this will make a lot more sense now that we've gone through this information. So again, you're going to get that page from the answering service. You'll confirm, and then you're going to call the facility to make sure the patient's age is 13 or above, that the exam was actually, in fact, within 96 hours. You'll give them your ETA. When you arrive to the facility, you'll advise the primary nurse that you're there and obtain report from the physician, most likely, if they've been in. You'll peek your head in with the patient and do a brief introduction, provide your name, your date of birth, and make sure that you want to confirm the assault date and the location. Did this happen in international waters on a cruise ship? And the chain of custody is going to be a nightmare to figure out. You want to know what you're walking into, and that's a real scenario that's occurred. But remember, you have administration that is absolutely willing to help at any time, 24/7. We're there to guide you. You'll gather necessary supplies as needed, the stickers, the speculum, maybe ask the facility to place the patient on a pelvic bed or put them in a private room with a door. Enter the room for the exam after you've gathered all your supplies. You're going to clean the area. You're going to make sure that any specific contamination sources have been cleaned. You can use the bactericidal or virucidal wipes that are provided. And I, again, like to place the chucks in that area because that's my area. That's a line of demarcation. No one goes near this area. And then you'll start with the consent form, the exam consent, possibly the DFSA consent. You'll open your kit and you're going to begin setting up your documents and starting. So the forensic exam, it's a step-by-step process. And remember, don't be worried about remembering the specific locations of the steps. once you actually see a kit, it's going to be very reassuring and comforting because there's a walkthrough, there's a very guided process. Each envelope explains what to do, and you'll see that firsthand when you get into your live orientation for your 2 days. So you'll also have a, when you're performing the forensic exam, you're going to let the patient know that any forensic photography that you're going to be taking will be shared with the physician. You want to make sure to remember your forensic photography skills, parallel lighting, no flash, making sure that it has a measurement device in it, making sure that the units of measurement are all the same, that match. You may use different units of measurement throughout the exam. However, if you're writing millimeters, then it better be a millimeter ruler that you're using. You want to contact the appropriate law enforcement agency and perform mandated reporting after your consent, and also at the conclusion of the exam to come pick up your kit. And then you're going to contact the MD and RN for report. Remember the MD first. You're going to go over the CDC guidelines, the assault characteristics, and that form for the MD reporting. Then you're going to provide a very brief report to the RN, and you'll assure the patient receives necessary medications as needed or that they're given by prescription. You're going to provide documentation, complete all necessary documentation related to the exam. This is when you're closing shop and getting ready to go home. You're going to complete the chain of custody and handoff to the appropriate law enforcement agency. And if the agency is not picking it up, you'll sign it over to hospital security. Once chain of custody is transmitted, then you're going to document your transmission of your documents through Forcura. So remember, you're going to transmit all documents, and then you're going to exit the facility and head home and pat yourself on the back for a job well done. And if you have any questions, let me know.